The National Coronavirus Command Council met on Tuesday to assess the lockdown regulations. It is believed that larger public gatherings are likely to be permitted, making it easier for political parties to campaign for upcoming municipal elections. But public health specialist Dr Lehlohonolo Majake believes it is too early for South Africa to open public spaces for vaccinated people. Her comments come on the back of the announcement by the government that it is considering opening public spaces like stadiums, cultural events, music festivals, and potentially moving the country to level 2. She joins us now to discuss this. Dr. Majake, great to speak to you this morning. Talk us through your fears about opening up stadiums and other public places.
Very good morning, Hugo, and also to the listeners. I think, first of all, I really do have great belief in the strategies that have been, to date, implemented by the various custodians of the health sector. And I think we have listened recently about the fact that the Department of Health is looking at the possibility of increasing freedoms when vaccination uptake is increased. I think at this moment in time, the conversation around vaccine and opening various public spaces and decreasing restrictions has really been around, is it too soon or should we wait a bit? And I think certainly we need to look at the fact that we look at 18% of the country that is currently vaccinated, and ideally in order for us to be safe and to confidently walk about knowing that we are less likely to have the huge surges that we've seen in the first, second and third wave, we need to ideally have about 60 to 70% of the population vaccinated. And I think at this moment in time, considering that we still have a lot of vaccine hesitancy, one would say that it would be completely early to freely open up spaces such as your concerts and sports centers for everybody.
Now, there is talk of the possibility of opening it up sufficiently to allow campaigning of political parties ahead of the impending general election on November 1st. What is the local elections, I beg your pardon? What is the impact if this were to happen?
So I think what various individuals who partake in the campaigning, in the door-to-door campaigns, etc., need to do is to also become custodians of actually spreading the message, the correct message about COVID-19. And I think we all know that when we look at vaccine hesitancy and we look at behavior in general, leaders in society really are very influential in terms of how people will respond. So this is an opportune time to have various political parties and custodians in the political sector actually being seen wearing masks, still social distancing, while they're trying to increase the messages about the various political parties, manifestos, etc. I think obviously the reality is, Hugo, we are in an environment right now where COVID-19 is not going to disappear anytime soon. It's here. It's still going to be here for a long time. We need to look at how do we restructure life at this moment in time in such a way that we still take care of ourselves, we still continue to run things the way they ought to be run nonetheless, and to minimize the scare, minimize the fear, remove the fallacies that we see at this moment in time.
Now, we've seen a few political engagements where politicians have gone out, in fact, where the supporters of political parties have gone out, and they've gone out in their numbers and totally ignored COVID-19 protocols. So can we in any way imagine that if we did allow political parties to campaign, that those restrictions will be adhered to?
So here, I think the question is not necessarily whether or not we need to continue with the campaigning and the various, activities that are taking place in general in South Africa. I think, yes, the focus is certainly right now in the campaigning space. But remember, we still continue nonetheless with all other activities. People still continue to go shopping. People still continue to go and get, their grants and so forth. So the question is, South Africa, how do we enhance adherence to non-pharmaceutical measures to ensure that we reduce the risk of actually cross-infecting each other? And also, South Africa, how do we start engaging about what is it that is making people reluctant to get vaccinations? What is it that we're most afraid of at this moment in time? I think it's crucial to understand that at this point, we need to really start having conversations that will encourage individuals to know that your actions about whether or not you take vaccines or not will actually influence you and also the people that you live with. And given the fact that South Africa does really have high levels of various infections where people can be, immunocompromised, it really is time that everybody realizes just the impact they have in terms of rejecting or accepting the vaccine. And at this moment in time, we certainly would encourage everybody to be vaccinated as soon as possible. And of course, we need to continue to social distance and still partake in all the other measures that have been acknowledged around the world and have been utilized to ensure that we protect each other.
Well, that encouragement alone is not enough, Dr. Majake. We've witnessed the fact that vaccination numbers are dropping. Government is struggling in this area. In fact, on the Health Hub earlier on, we talked about the fact that as soon as an age group is allowed to vaccinate, they come in, they vaccinate in their numbers day 1, day 2, and then there's a massive dip. What needs to be done? What are those conversations beyond, guys, get up and get vaccinated?
So vaccine hesitancy, first of all, is not unique to our country. It certainly is a challenge that is around the world. And there has recently been a study conducted by the IMF that looked at the various complexities around vaccine hesitancy. And you're absolutely right that initially the conversation was around we need to tackle those who are most vulnerable. And so those are individuals who were 60 plus and also those who had various comorbidities. And of course, we saw the dip in that and thereafter opened up to the younger individuals. What is really critical, and if you're young and you're sitting and you're watching and you're listening and you haven't been vaccinated, is that just because your peers haven't necessarily had COVID or you feel you're healthy enough not to get the vaccine itself, doesn't mean that everybody else around you is also equally healthy. And so what you need to do is to try and encourage and help the country to get to what we call herd immunity in order to ensure that even the individual that you come across who is at risk of getting COVID, if they do get COVID-19, that they are less likely to then get the complications that we see. Because at this moment in time, I think the rush against time is we need to encourage individuals to get vaccinated to reduce death. We've seen the effect that the Delta variant has had. We've seen the impact on the health system, hospitals being full, etc. How do we curb that? By getting as many people as possible vaccinated.
Now, one of the things that we've seen overseas, certainly where sport is concerned, is that stadiums are full again and people are living their best lives, so to speak. There's also talk that the bulk of individuals that are being hospitalized are those that are unvaccinated. Can you corroborate this?
Absolutely. I mean, what great pleasure can we possibly have as a society, as a community, if we then have restrictions lifted and we can go back and go watch our favorite clubs, the football clubs playing soccer. And I think certainly one thing for sure is people say, but I don't see the point of getting vaccinated. People still continue to get COVID-19 even after vaccination. My answer to that is absolutely, you can still get the infection after being vaccinated. However, the complications are less likely. So the question is, what is it about COVID-19 that makes it impossible to manage? It is when you get infected, your body can't respond to it correctly. You haven't been immunized, so you're not protected from it. And what happens is you end up becoming ventilated, getting other complications from the lungs into the kidneys and so forth, and then having doctors not being able to salvage you. So with vaccines, we can certainly reduce the impact of getting other additional illnesses that then really impact the body negatively when you get COVID-19.
Dr. Lehlohonolo Majake, thank you so much for your time this morning, a public health specialist, in conversation around is it time or not to get back into the stadiums. And her suggestions right now is let's keep getting vaccinated.